Unfortunately, I think during the pandemic, what was top of mind for people were some of the negative stories that were out there. A few weeks ago on our podcast, we interviewed Dr. Buffy Krychek, who wrote a book called Broken. And she detailed in this book some of the challenges that people in the post-acute space and nursing homes had with getting PPE, as you just mentioned. It was amazing to hear about how far too often the nursing homes were the last place. And it wasn't because PPE wasn't available. It was because they couldn't get people to send it to them because they weren't buying in bulk like some of these larger facilities are. Now, where do we sit today? What's the biggest challenge that you're seeing in this space with keeping these post-acute areas as top of mind?
Sure. I think that thankfully, we are in a much better position with COVID-19 and we were able to get supplies. Obviously, there's still some looming supply chain issues, but overall,
Sure.
We're back to a more status quo. But I think that we just have to continue to fight and to be able to show policymakers, show the community, show the public, show, whoever we can, whether it's local or federally, that this service is needed and that, again, we are caring for these people, that this is their home, that we cannot work without supplies, that we cannot work without funding, that we cannot, do our jobs without the support that we need. And so we have to show them, the stories of these people living in the facilities, of the healthcare heroes that, worked the last 2-3 years during a pandemic tirelessly with, no days off. We heard stories of people sleeping in RVs in the parking lot so that they could stay without having to, go home and contaminate their family, just at the varying developing parts of the, the pandemic where we didn't know what was going on. And, just to be able to show that, we do have these healthcare heroes and these people that care so much and show up to work every single day with just loving hearts, wanting to provide the best care for just such vulnerable people that have, multiple comorbidities or can't walk or don't have family or, whatever it is, that it's their home. And not everyone sees long-term care as that. They think that it's a bad word and that it's not a viable place or it's not a great place for people to live. But that's just not the reality. The reality is that it's a much needed service. We've got a growing population of older adults that's going to continue to stress the long-term care system over the next few years. I mean, we're already seeing that happening now. And we've got to make sure that we have the support and the resources and the funding that we need in order to continue providing this much needed service.